the UCP government to provide most community laboratory services in Alberta is going to war with its employees. After a year of negotiations, talks have broken down, and if mediation is not successful, there may be a strike or a lockout on the horizon. And despite the UCP's promises that DynaLIFE would provide more timely access to care and a more stable workforce, that has clearly not been the case. DynaLIFE is drastically understaffed, currently dealing with 200 empty positions, and wait times are agonizingly long for community laboratory services. For weeks, I and my caucus colleagues have been hearing from concerned and frankly distraught Albertans about lengthy and frankly unacceptable wait times to get an appointment for timely lab work. Albertans like one man with reduced kidney function who needs to have his blood drawn and monitored regularly but is facing a 3-week wait. Or the patient who waited 6 weeks for an appointment and arrived to find a waiting room packed well over capacity, posing concerns about both viral transmission and fire safety. That Albertans are waiting weeks and yes, sometimes months to get basic blood work done is another clear and disastrous result of the UCP's mishandling of our healthcare system. The erosion and mismanagement of our publicly funded healthcare simply cannot continue. Albertans' lives are at risk because of the chaos in healthcare inflicted on our health system by Danielle Smith and the UCP government. DynaLIFE needs to be held accountable to Albertans to deliver the timely care that they were contracted to provide. Should the Alberta NDP form government in May, we will end the chaos in healthcare. We'll support our frontline healthcare workers, and we will ensure Albertans get the care they need when they need it, and that definitely includes timely lab work. Thank you, and I'm happy to take any questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, star 9. Please state your name and outlet, and we'll start in the room.
Hi, Catherine Gurkowski, Alberta Today. So yesterday, Alberta Health Services issued a news release saying they were looking to expand clinic hours to evenings, weekends, adding more locations. How are they able to do that if the talks are breaking down?
That's a fair question. As we've noted, 200 empty positions currently for DynaLIFE. So much as we've seen with the UCP's announcements on a number of fronts, they're very happy to talk about new ambulances or opening new beds, but they have never addressed the key problem, which is a lack of staffing in our healthcare services. And a large part of this has been because of the UCP's repeated decisions to put our healthcare system to the limits while fighting with, in fact, attacking healthcare workers, including doctors, nurses, others all throughout the system. So the only way we create more capacity is if we are able to get more healthcare workers. And if DynaLIFE is at a point where they are looking at going to war with their workers, unable to negotiate fair pay for all workers doing the same work, I fail to see how we're going to be able to increase capacity in the system.
And some of the things they've done to address some of the issues you said, like about the packed waiting rooms, they have this new tool called Q.me, where it's a save my place. You can save your place in the line and then walk off site and then be notified when you're ready. What else can be done to address what's going on?
So certainly I welcome any additional tools or innovation that may be brought to the table that can help to address the drastic wait times that we are seeing here for Albertans. Ultimately, it's clear the only things that is going to address this is to get more staff in. And so frankly, I think it's not going to help get more staff in if DynaLIFE is fighting with the staff they have. So I think we need to see a fair, balanced, negotiated settlement with these workers to ensure that they are paid fairly and equally for doing equal work and provide that opportunity, and that will help to backfill some of these other positions. One of the other things I would note, sorry, I lost my train of thought. Yeah, absolutely. We'll leave it there. Yeah, thank you.
Thank you. We'll do one more pass for questions. Just a reminder, if you're on Zoom, it's raise hand. If you're on the phone, it's star 9. We'll go to our caller on the phone. Your line is open.
DynaLIFE needs to hire more people. In the release yesterday, it said the CEO, Jason Pincock, said that that's what they're trying to do. It kind of sounds like that this is just a similar effect of nurses and doctors, just general health, a dearth of healthcare workers available to come to Alberta. I'm wondering if you have thoughts on how to improve just getting more staff into DynaLIFE, full stop. I feel like
Certainly.
you touched a little bit on this, but I wonder if you can clarify that.
No, thank you for that question. I'd say there's a couple of factors here. And the first, and this is where my thoughts were going earlier, and I lost my train of thought. The first is that, the UCP government has been bent on racing forward with increasing private delivery of public health care. More public dollars going to private corporations, private individuals to provide public health services. And we know in those cases that those dollars then also have to go to cover the profits for corporate shareholders, as well as providing care. And in that rush, the UCP has unfortunately not put care for Albertans first. So they have rushed into this process, rushed to hand this over, to try to get it done before the election, and unfortunately not really thought through what those impacts are going to be for Albertans. This has clearly not been the smooth transition that was promised. Now, secondly, yes, you are correct. The issue that we have here, clearly in part, is those 200 empty positions and the need for further capacity and staffing to be able to meet the needs of Albertans. Of course, they knew what those needs were going into this contract, and they knew what the level of demand was. It was quite clear. People have not suddenly started demanding more blood work now that it's being handled by DynaLIFE compared to when it was handled by AHS. But we have seen a serious increase in wait times. But ultimately, if we want to solve the staffing crisis, we have to treat workers better. Without question, we are short nurses, we are short doctors because they burned out during the pandemic, because the demands placed on them were so high. The pressure put on them by the UCP government, by its decisions to repeatedly act last and least to push the system to the limit, increased that pressure. And then, of course, the UCP government demanding wage rollbacks for nurses, respiratory therapists, paramedics, folks on the front line during the pandemic, not to mention having torn up the contract with doctors and started a war with them, which continued throughout the majority of the pandemic. So in this situation, we have DynaLIFE, who is saying, you know what, well, the workers that we hire inside, we are going to pay them less than the workers that we are bringing over from Alberta Precision Laboratories, creating an imbalance and an inequity that's not something that's going to attract workers to fill these much-needed positions for Albertans. So ultimately, I think we need to see a fair negotiated settlement here. DynaLIFE needs to prioritize providing the care that they are contracted to provide to Albertans, timely access to laboratory work. They need to settle this situation and get down to providing Albertans with the health care they deserve.
Do you have a follow-up, Adam?
If your party does come into power in this election, would you then be looking at revisiting this contract, or even the contract with DynaLIFE, or even moving all the lab services back to APL?
So if we have the honor of forming government, an Alberta NDP government will take the steps that are necessary to ensure that Albertans have access to timely care. That is our commitment across the system. We have a plan for primary care. We're going to be working to address the pressures that we have in EMS and in hospitals, and we will do the same when it comes to laboratory services. So certainly that will be our priority, and if DynaLIFE is not able to meet the terms of its contract, well, then that's a discussion we can have at that time. But our priority will be to ensure that Albertans have timely access to laboratory services.
Thank you. Adam, we'll do one more pass for questions. Just a reminder, if you're on Zoom, it's raise hand. If you're on the phone, it's *9. Catherine has a question?
Always another one. So DynaLIFE has been providing community lab services in Edmonton. The difference in Calgary, I guess, is there's public labs in the community setting. Why has the rollout for DynaLIFE, same company, been so different in Calgary compared to Edmonton?
So that's a fair question, and certainly I don't have all the information on the ground. This is the contract between them and the government that's being coordinated through AHS. I don't have access to all that information. But certainly what I can say is this government and DynaLIFE should have known full well what they were getting into. We know what the level of demand was. We know what the systems are. This government was in discussion with DynaLIFE for at least 2 years about them taking on this contract. So the fact that they seem to be handling this transition so badly. Now, I recognize, of course, we had the COVID-19 pandemic, but again, those discussions were ongoing during the pandemic, and AHS knew what the level of demand was and what the issues were in the Calgary area. Now, I do understand that there are some other elements, such as the implementation of Connect Care and some of these other systems, which may be impacting things. Perhaps staff are training, perhaps they're having, but again, those are things the UCP government, AHS and DynaLIFE would have known about. So again, this seems to me to be, frankly, a dereliction of duty on behalf of this government, which has been so embroiled in its own internal drama and desperation now to try to make up ground for the upcoming election that they clearly are failing to do even the most basic work to ensure timely access to care for Albertans.
That's great. Thank you, everyone. That concludes our conference for today.
Thank you.